Hi everyone, I'm Cindy Crosby from birthsmart.com and I am sharing the 6 traits of optimal maternity care. The topic for today is that interventions are performed when medically justified rather than routinely. And I think this topic is so interesting just because it seems very common sense, logical, that everyone could agree on it. But in practice, it's really difficult to implement just because it requires such a judgment call. And when we look at intervention rates across the country and across the world, we see a very wide range of statistics. Just taking the cesarean section rate, for example, we look at, there's a hospital in Southern California, in Riverside, California, and they have a 9% cesarean section rate. But then we travel to the East Coast, to Miami, there's a hospital there that has a 71% cesarean rate. And I'm sure you're sitting there asking yourselves, what is so different about these women in California versus the women in Florida, that those in Florida would require that much more medical intervention? And I think common sense dictates that it's not the women who are so different, but the care practices of those institutions and of those providers managing that care, and their definitions of what is medically justified. And there's no question that there are rare instances where cesarean sections and other interventions are needed, and they can save lives and they can be very beneficial. But each one of them comes with benefits and it comes with risks. And so if they're not necessary, applying those brings a whole series of additional complications and consequences that are unnecessary and unwanted if that's an unneeded intervention. So as we go forward with care in our pregnancies and births, we want to be able to avoid unnecessary intervention, but we also want to be able to identify those circumstances, rare they may be, when they are necessary. And so to do that, we really need to be able to develop a relationship of trust with our care providers. We need to not assume that we're on the same page with them. We need to not assume that they believe in our ability to give birth. Many providers, they don't trust women to birth. They want to control and manage every aspect of that. And so it's important to ask a lot of questions and to do a lot of research as you're establishing and developing these relationships. And if you're in a relationship with a provider who is not on the same page as you, I would encourage you to seek out alternative care because you're setting yourself up for the best possible outcome if you are prepared and if you have a good relationship with that provider. So I just thank you for the time you're taking to prepare for your birth, and I wish you all the best and look forward to sharing more with you. Thank you.